So the shoulder replacement, the way that we're doing them today, when the shoulder surgery is done, the prosthesis and the joint are stable enough to start light activities immediately after surgery. So you're going to be in a shoulder sling or expect to be in a shoulder sling because of the nerve block that we do for pain control, but you can take that sling off the day after surgery and start gentle motion. The motions that we want to do are first elbow range of motion. So we straighten the elbow gently and we bend it, and we repeat that 5 to 10 times. So gentle elbow flexion extension. We can add rotation of the forearm. So we turn the hand down towards the floor, up towards the ceiling, also 10 times, and then squeeze the fingers, squeeze and hold, and then the wrist in circles. And then the pendulums and Codmans. You want to show them how to do pendulum and Codmans, Kyla? So you stand up just like the ones we did earlier, and then lean. And then the Codmans, you just do those small circles. And then the other way. And then the pendulum back and forth and sideways. And just lean just a little bit so you don't hit your back when you're doing that too. You can also lean forward as well if it's easier to do that. You can have a seat. So those are the pendulum and Codmans, the elbow range of motion exercises, wrist and hand and forearm. After total shoulder replacement, we used usually aspirin for DVT prophylaxis. That's to prevent forming blood clots. So you can start taking the aspirin the day of surgery. Baby aspirin 1 time a day or twice a day are both okay, as long as you don't have allergies to aspirin that you know of. And we usually just use Tylenol and naproxen sodium, which is like a leaf, to help with pain control. And then we use the cold therapy system to circulate cold water around the shoulder. And when we do that, we usually don't require narcotic pain medication or just a small amount. The bulky dressings over the total shoulder replacement can come off 2 days after surgery. There's going to be deep glue type dressing stuck to the skin that will fall off by itself. When the bulky dressings, which is the cotton and the tape around your shoulder, comes off 2 days after the surgery, you can start showering. Keep the wound clean and dry, and do not immerse the wound underwater or go swimming until it's been a month after the surgery.
Thank you.
Now you can resume light activities after total shoulder replacement, like brushing your teeth, feeding yourself, and hygiene the day after the surgery, after the block resolves.